set up. So this box is the simulator. So
hold on, we got a couple other stragglers.
They'll live in a little. It's about the rhythm simulators. Right here, these boxes will live in there. And what you need is this one here, this box.
Make sure you show it so everybody can see.
This one here, and it has all these little purple dials on here. And you also need your wires. That is connected to the defibrillator machine.
Which is older than dirt. So ours is big and old, but it works. So that's what we're using for right now.
So so you can actually, when you do input, press on a little option on here, it will actually, the rhythm will show up on here. So in the, you can.
Let's go to the man. Let's go to the man. The one that has the green is the one that goes to the little box. From the patient, remember?
Oh, I see.
Yeah. So you guys, it's okay. No, you're fine. So this one has a green color chart. It's got places for 4 leads, and the one that's hooked to the mannequin here has places for 4 leads. So you got to make sure the one with the green, because the one from the defibrillator only has 3 leads, like we'll do on a patient. So you just match up the colors. And this is all just so we can simulate a real rhythm. So what will happen is this little box has got different rhythms on it, and when we push the buttons, we can make the rhythms actually come up on the monitor.
Where are those plugged into?
This one is plugged into the mannequin. So it's actually part of him. So these wires will come from this guy.
Okay.
They're attached to him internally.
All right.
And then we're gonna hook up the monitor to him.
There you go.
And
So that's not something that we would normally have?
No, that's what I'm saying. We have this here to simulate a rhythm. So this part you need, because when you're practicing together, you need to be able to make a rhythm. But on a real patient, we're just going to hook up the 3 leads here to get a reading there. So this is for practice to be able to, but in a real world, this wouldn't be here, okay? But you have to know how to hook this up, because I don't want to come and tell everybody every single time that they want to practice how to hook it up. So this box and that defibrillator are in the vent lab on the shelf. And when you're done, the defibrillator and this box go back there. These wires with the green stay with this guy. Those wires stay with the defibrillator. Okay.
And then these white on the right. And then these are actually, there's like these plastic tabs that are, this is a little higher than normally is. And then smoke over fire.
Here. So the ones that you guys are going to hook to say do not defibrillate on them, because they're the special ones that are going to make the mannequin that is plastic have a real heart rate. So on a real person, the patches go here and here and here. You guys have probably seen that by now. So for practice, we're just going to hook them to this one and this one and this one so that you can actually get a reading on the monitor. Okay. So for competency's sake, and when you guys are practicing, you want to have this part already hooked up. So when you guys come in to test, I would already have this hooked up. Or as you're practicing and you're practicing testing, you're going to have this part hooked up. Then when you come in and you're the person who's taking care of Mr. Joe here, you're going to attach his leads, because that's part of your job, is to get him hooked up to the monitor. Because once you attach his leads and we turn this on, when you turn the monitor on, there'll actually be a rhythm on there. So this has just got an on-off switch, and it has little abbreviations to put it in whatever rhythm you want.
And this one, there's a power right up top. Yeah. And it's going to give you a heart rate here if that rhythm has a heart rate. Associated.
Let's put that guy up here while we're showing them so everybody can see it. You guys want to come around and make sure you can see the rhythms. Oh, it's probably because I just plopped the monitor on top of his chest. It doesn't usually have all those squigglies, but that's normal sinus rhythm. And then we could change it to...
It's just interference.
What's that?
It's VTAC.
VTAC.
Monomorphic.
Monomorphic VTAC. And what's this? Polymorphic. And what's this? SVT. Yep. And what's this?
Normal.
We don't know.
Tachycardia.
Tachy.
How about just plain old sinus tachycardia? Yep. And normal sinus rhythm.
That's Web 60. VPIB.
Yeah, that's VFib. So VFib versus VTAC. Tall and regular, VFib is fine and fibrillating. That's Brady. So those are all the different, so I just did that just by pushing. So when you guys are practicing, whoever's doing the rhythm thing for you, we just kind of put it in the back and you can press it over to what you want while the other person's hooking everything up.
Does that have all the hard parts in it too?
Yeah, it does. Yeah.
Does it have an option to do pulseless and?
It doesn't. What you would have to do is pick a rhythm, more likely like normal sinus rhythm, and the patient would not have a pulse. So somebody would have to ask, does the patient, you would have to ask, does the patient have a pulse? And you would say no. And then we would know it was PEA. Okay? So, can you help me move this back down here? This is heavy. Thank you. So that's how that works. So, when the guy comes in or the lady comes in, we'll tell you your scenario. You want to practice, so what's the first thing that we're going to do? Oxygen. So you'll get a cannula, put the nasal cannula on. At this point, when you're able to do something, we do everything that we possibly can from a testing, practice, competency standpoint. So we can put oxygen on the guy here, so you're going to put the oxygen on. We can put a pulse ox on them, so we're going to do that. We're going to attach them to the monitor. And we also have a BP cuff, which is over there. So if you're not sure how to get it on this guy, then put it on and practice that, because that's also going to be part of the scenario, is attaching the BP cuff, because that's everything that we have to do. That point, huh? No, but you're going to tell me. You're going to verbalize. So oxygen, establish IV access, you're doing everything else, and at the same time you're asking him questions. Remember that there's always a possibility too that a family member could be there. Maybe the wife came in with the patient because they were unconscious. Not everybody's going to be able to talk. So you might be able to talk to a family member as well. And those are different scenarios that you guys can make up. You know, he came in unconscious, but the wife was with him and she's there and she's going to tell you about the patient. So then you'll turn on the monitor and you'll be able to see the rhythm. So at that point, based on the information that you were given, so when you put the pulse ox on, you'll get a pulse ox. When you put the blood pressure cuff on, you'll get the blood pressure. The heart rate, you may or may not get from that depending on the rhythm. And then from the questions that you ask, you'll get answers to them. So based on all of that information, you will now have to determine based on the rhythm and if your patient is stable or unstable, what treatment you're going to do. So if you don't put a blood pressure cuff on, I'm not giving you one. So if your patient's hypotensive, you won't even know. So this is exactly kind of how your simulations go next term as well. Because if you don't pick information that you want, you're not going to get it. So it's important that you remember to ask for the information that's important. So blood pressure, pulse oximetry, what's the heart rate? Is my patient, what's their level of consciousness? What do they look like? You know, and then you can start asking, when did the pain start, and all those things. You can always ask, is the patient diaphoretic? Does he have edema in his feet? Because he's coming in as a cardiac patient. Maybe he has CHF and you just don't know it yet. So those are other kind of questions that you could ask if you wanted. So then once you determine whether your patient is stable or unstable, you'll do your treatment. Based on your treatment, you'll get at least one change in symptoms. Either it's going to get better, it's going to get worse, or whatever. And then based on that, you'll have to decide what to do. And then at the end, he'll just be better or dead, one of the two. if you have to do cardioversion, this is how this will work. So the leads are here. We can get the patient on the monitor. The cardioversion or shock, if you have to defibrillate, these are the pads that go on the patient. So keep in mind, once you put the leads on and get your patient, we need to cover him back up. We got like a real person here. That's what we're treating him like he is. So don't keep them all. So now we decide we need a cardiovert. Okay, you're gonna feel a big shock, or we're gonna give you some medicine to make you sleepy because we need to get your heart rate back. This tells you exactly where they go. If they're the yellow ones, which these are, shows you that one goes here and one goes down here. If it was the purple pads, one goes on the front and one goes on the back. So you have to know how to do this too, because if you're going to cardiovert, you're going to have to actually put the pads where they need to go. Now we can leave those like they are, because that's what we would do. And then on the monitor, you're just going to verbalize that you're going to come to the monitor. You would put it to the joules that you wanted it to be. If you're defibrillating, we just have to set the joules that we want, press charge, stand clear, and it's important that this step is done as well. When we say stand clear, everyone backs away and holds their hands up. And then you would say shock, but we're not going to actually shock because this is real. If it's cardioversion, then you're going to turn the dial to whatever joules you want. You're going to sync, then you're going to charge, stand clear, and shock because you need to sync. If your patient got bradycardia and you gave atropine and it still wasn't better and you needed to do transvenous pacing, then all you'll need to verbalize is we're going to set it to the pacer or pacing dial on here to a rate of 80 or whatever the rate is, and some kind of normal sinus rhythm rate. And defibrillating, I think I already said that one, didn't I? Just go all the way to 360, charge, and shock. Charge, stand clear, shock. Okay? So, that's how this is used. And that's the different things that you'll have to do.
Have to be taking the pads off and sticking it on, or just putting it like that?
No, they're just like this. And then the other ones are already stuck to him. So we're not actually taking pads and putting them on, but we do need to know which wire goes where. White to the right, smoke over fire, so the dark one on the top, the red for fire on the bottom on the left-hand side. Remember, it's the patient's right, not your right. And then just remember, while we're here with our simulation box, we have to do these ones up at the top. But normally they don't go on the shoulder. Normally they go there and there. So they're way up top on the shoulders, and the one on the side is way over here, as opposed to more up here. Who else? Anybody?
All the meds are in that box that you need.
No, if you were going to give meds, you would just verbalize. Yep. So I actually will probably have an IV pole over here, because we have one that, you know what I'm going to do is I'm going to put the IV pole with the stopcock on there for the adenosine, so you could talk through giving 20 and then the saline fast push, because the other ones are just regular push. Anything else?